Geddes-Bruce, and I'm excited to talk to you today about our two main forms of body contouring, probably the two most well studied, the most clinical research, the most efficacious, and they are liposuction, particularly smart liposuction, and CoolSculpting, which is our non-invasive fat body contouring device. And going to give you a little bit of information on what is best for you. At the end of this talk, so I'll talk a little bit about the two different modalities, what they're like, go over some before and after photos, and then at the end we'll have some time for before and after questions. On the talk with me is our lovely consultant Devin, and she is brilliant and can answer a lot of questions as well. Feel free to type them in the chat, and we'll address them at the very end. Okay, again, who am I? I'm Dr. Elizabeth Geddes-Bruce. I am a board certified dermatologist and I am fellowship trained in cosmetic procedures and laser surgery, which means after I completed my dermatology residency, I went on for additional fellowship training in these procedures. I consider myself an expert in surgical and non-invasive body contouring. I've been doing liposuction for now a solid decade, and I actually did my training under Dr. Jeffrey Klein. Dr. Klein was the inventor of tumescent liposuction, which is done with fluid, and we'll talk about that in an in-office procedure. Um, and again, non-invasive body contouring, we're going to be talking about CoolSculpting today. I practice out of the Far West office at Westlake Dermatology. We've got lots of offices all over the place. Mine is sort of north central Austin, off of Mopac, right by a Starbucks. And our consultant is Devin, who I mentioned earlier, who's on the talk with me. This is our phone number if you want to reach out to us to schedule a more formal consultation, get more information, see us for any of your skincare needs or any aesthetic stuff. It's 512-610-1000. And this is my Instagram handle. I'm always trying to balance oh, yes, be more active on social media. Patients like the education. It's good to show your before and afters with my own personal, like trying to get off of social media in my personal life and set good boundaries that way. So if you are an Instagram person and you'd like to see some before and afters and hear me chatter occasionally, that's my handle. So, what is body contouring? Body contouring is what we are doing when we are trying to just improve the overall shape of the body. And we do this by doing some targeted fat removal. This is different from overall weight loss. A lot of patients these days have gained control of their life and their body and by taking the different GLP-1 inhibiting drugs and done great with overall weight loss, but improving the shape of your body is considered body contouring. And we can do this either surgically or non-invasively. The surgical way we're going to discuss today is smart lipo. The non-invasive way is CoolSculpting. Both of them have permanent results. And I'll talk about that a little bit more. And our goal is really to kind of help you decide like which one is best for you. And it really comes down to three things. One, the degree of results that you're looking for. Two, your downtime that you're able to give up. And three, your overall budget. We're going to compare the two different things. CoolSculpting versus Smart Lipo. So CoolSculpting. CoolSculpting is non-invasive, meaning no poking into the skin or the actual fat. It has no downtime, meaning when we take the machine off of you, you get up and go and keep going on your day. There are very rare contraindications to having it done. The results happen slowly, and there's a limited amount of fat that's removed with each treatment session. Whereas Smart Lipo, this is a surgical procedure. It is only surgery on the outside of the body. It doesn't go inside the body. It goes to treat the pinchable fat that you can kind of pinch with your fingers. You have a downtime of about less than a week. It means not that it's a whole week that you have to be hiding in your house, but you are going to be recovering afterwards. There are a few contraindications, like we can't do patients who are on blood thinners or have active cancer or any diseases that impair their healing. After you've gotten through the healing process, the results are quite visible quickly. And in Smart Lipo, in one setting, you can remove a much larger amount of fat all at once. So first, I'm going to go over Cool Sculpting. Cool Sculpting is a machine and a type of technology that has been around now for quite a long time. And it is not a temporary procedure. So what happens is these applicators are applied to the skin, and the fat cells are selectively cooled um, while protecting the outside of the skin. And then the lymphatics kind of absorb those dead fat cells over time. The fat cells that are gone, they are gone, but you can see it's a much smaller proportion with each treatment. But it is not just shrinking the fat temporarily, and I'll get into that more in a bit. Cool Sculpting has been around for quite a long time. It's FDA cleared. It has so many studies behind it showing that it is efficacious. And there have been more of these treatments done worldwide than probably any other non-invasive body contouring device. And you can really use the applicators almost all over the body. These are all the FDA cleared areas under the chin, on the flanks and waist area, the stomach, bra back, right underneath the buttocks called the banana roll, above the knees and the thighs. When you come in to meet Devin or me, we will look at your body and see the different areas that are good candidates for cool sculpting, and then come up with a price quote unique for you. And this is what the applicator looks like. We can change it a little bit, but it's designed to curve and fit around the body. But you can see that it is a set kind of pattern. So sometimes people come for wanting to treat like the chin, and actually they don't have enough fat to fit into the applicator. They really are a better candidate for smart lipo. They can target kind of a small little area. So there's a little bit of figuring out like which one works best for you and coming up with that plan. We have the latest version of this device, which is the Elite, and it does freeze the fat and get more out than prior versions. And what is it like when you come in? Well, this slide's a little old because the Cool Sculpting model has changed in the last year. But what happens is you come in and we mark the area that you're going to be treated with the applicators, and we really apply as many applicators that are needed to get full coverage. So the new model with Cool Sculpting, you pay for the area, not for the individual applicators. And then you kind of sit back. We clean off the area and apply a cooling like little gel pad and apply the applicator to you. And the first few minutes, it's a little bit chilly. And then after about 5 minutes, it goes numb. People bring their laptops, they do their work, or they watch a movie, or they turn off the lights and go to sleep. And then each applicator takes somewhere between 30 to 45 minutes, and then the applicator is removed, the area is massaged, and then you move on to the next applicators. It can be kind of a long day if you're treating a lot of areas or if you have a lot of surface area to go over. So with Cool Sculpting, as a recap, right? So you get approximately 20% reduction of fat, maybe more, depending how well you respond to it and how many sessions you're able to do. You see the results somewhere between 1 to 3 months afterward. And a lot of people really need to maintain their weight, because if you go up and down a lot, then those fat cells that weren't targeted, they will just grow bigger and kind of take the place of the cells that you've eliminated. So, if you really need to have kind of a stable weight to really appreciate your results. The contraindications are that you should not have had surgery that goes into the treatment area the last 6 months, and you cannot have any abdominal hernia where one of your bowels is, you know, coming from the inside, pouching out to the outside. Afterwards, sometimes people get a little bit of redness and swelling. It's a little tender, a tiny bit, nothing remarkable. Some cramping or bruising. With the newer device, we really do not see much nerve pain. I haven't seen it in years and years and years. There is a rare condition called paradoxical adipose hyperplasia. I always like to talk to the patients about this. I actually wrote a paper on it back in my fellowship, so I've been very well aware of it. This is the thing that made the headlines when people were talking about, oh, Linda Evangelista, and she used CoolSculpting and it just made her blow up all over. That's really not what happens. What happens, and you can see, is the fat starts to grow in the shape of the applicator. It's quite rare. And if that happens, the treatment is liposuction. The average cost for one area of treatment of CoolSculpting, I just want to go back to the paradoxical adipose hyperplasia. It is very rare. I have seen it. I've still done CoolSculpting. I know that these things can happen in medicine, but there's always risks that you take. Again, this is extremely rare. All right, so the average cost of CoolSculpting for one area is first it's 2,400, and then when you add on different areas, the price goes down. So each additional area is 1,200, and there's all sorts of different promotions. Like this month, CoolSculpting is 500 off. If you attend this webinar, you get $200 off. I should say it's $500 off if you do more than one area. If you're attending this webinar, you get $200 off. So that is something that's helpful. But you would need to come in for a CoolSculpting kind of consult and look at you and kind of come up with like what areas you want to treat. These are some photos that are actually from the CoolSculpting rep, and you can see a nice improvement before, during, and after. I think the patients actually get better results these days than these initial pictures from years ago. I think the slide deck is pretty old, but you see a nice improvement, but it's even more now because we're able to use more applicators during the therapy. So treating that back fat, bra fat, flanks, things like that. You can see if you compare the blue lines, the before versus the after, and the change in the circumference of the arm. All right, switching gears. Now we're going to talk about SmartLipo. SmartLipo is a form of laser liposuction, which means that during the procedure, a laser is used before traditional tumescent microcannula liposuction is performed. So what is liposuction? Liposuction removes fat cells from targeted areas. You need to be a healthy and active individual. And again, like we discussed before, the downtime for treatment is on average less than a week. You wear bandages and compress the area immediately afterwards, and the results are immediate. That fat is removed, but you do get swelling from going in and disrupting the tissue. So swelling can kind of obscure some of the fine results until all the swelling subsides. But you'll never end up being bigger than when you first came in. How does it work? Well, the fatty tissue under the skin is filled up with a lot of dilute fluid filled with anesthesia. So I tell my patients, just like when you have a skin cancer and you're awake, but we numb the area with fluid, and then I remove the skin cancer and close you up, you don't feel that surgery. That's kind of the same as liposuction. We fill up that fatty layer with very dilute fluid. It becomes very firm, and that helps it easy to remove the fat. This is a little bit to discuss kind of like liposuction in general. So you start off with your baseline weight and shape. If you were to lose weight, See, I'm going to start here, right? So here it is. If you were to lose weight, just weight, you still have the same number of fat cells, they just shrink in size. If you gain weight, those fat cells regrow back up again. Liposuction removes the fat cell, so that changes the overall contour of the tissue. If you lose weight, actually the results look even more incredible because then these fat cells shrink down. How does smart lipo work? Well, the actual procedure is very safe. You're awake, you're breathing on your own, you're not under general anesthesia. There's not any devices making you breathe or making your heart pump or anything like that. You're awake. People get up and go to the bathroom during the middle of it if they have to. Um, it's very safe in that way. We prescribe medications like antibiotics to prevent infection, a medicine to make you kind of a little bit more calm, and Tylenol 3, like with a little bit of codeine afterwards for some of the discomfort and some nausea medicine. You come in, we mark you, take pictures, and then the nurse puts in an IV and starts to numb the areas. So adding that dilute fluid. After that fluid's kind of settled for a bit and the tissue is numb, then I come in and we perform the laser, the Smart Lipo laser on the area. And then once that fat is softened, then we take the classic little cannulas, micro cannulas, and remove the fat. Then we dress you. We put the bandages on the area and some compression garments, and we send you out, and you go home and you kind of take it easy over the next couple of days. So that's kind of the difference between the two procedures. I'll show some before and afters for Smart Lipo now. Um, if you are on our website, there are more updated pictures than this deck. You can go to like Westlake Dermatology, and then you go under body contouring, and then you go under Smart Lipo, and you can actually filter results. You can go under my name, Dr. Geddes-Bruce, and see a lot more of the photos than I'm gonna just show right now, or any other person, and see um, different results. All right, so we can treat the submental chin and neck. And this is this area under here to really improve the contour. You can see nice results there. Just making it less hanging down and improving it, making it more straight, making people have a little bit more of a shadow along the jawline. So you really disconnect the face from the neck, make them two separate things. You can treat your arms. You can see instead of the area kind of swooping down, it's straighter. And the overall arm circumference is smaller. It's just improving that contour. Sometimes people get some nice muscle definition if they can, continue to exercise, they lift weights, things like that, then you can see some nice muscle tone. We can treat your hips, waist, and flanks. These are the areas kind of along the sides of the body, or sometimes people call them love handles, and really improve those contours. You can treat your upper and lower abdomen so that the stomach area doesn't stick out as much. Sometimes that's a stubborn area on people. And our most popular procedure, because it enables us to kind of target everything all at once, is Lipo 360. And that's where we do the upper lower abdomen, the waist and flanks. And depending on your body type, we might need to add that bra back area or also your hips. These are just some pictures of some Lipo 360, where you see just an improvement in the contour. I always say this girl looked great before, and she just looked even more incredible after. But safe for all skin types. Nice flattening of the stomach. And also, yes, we do treat men too. Usually it's that they really are interested in that kind of flank area or their stomach. So the recap again, cool sculpting versus smart lipo. Cool sculpting, non-invasive, almost every person is a candidate. There are very few side effects, no downtime, up and running. Your results are a little bit more limited on how much fat is removed per session. It ends up being a little bit more money per area, depending. It's hard. We have to kind of give you like an individual quote. Whereas smart lipo, this is our surgical procedure. You've got to be generally healthy. There are some expected side effects, some discomfort, some bruising, some swelling. You do have to plan for it, have a little bit of downtime. The results are more dramatic. And for most people, it's a quicker, better value. So where do you go from here? We offer consultations here at Westlake Dermatology. Devin is here at our Far West location every other Monday or something
Yes.
like that. Is that right? And she is able to spend time with you and go over the different options, even talk about other procedures if you're interested in them, and can verify your discount for attending this webinar. Again, this is our Far West office, and this is our phone number. And I think that is it for the slide deck. Devin, I can't really see the questions. Can you see them from your screen?
Yeah, I'll go over them with
Great.
you. So the first question that we had was how many applicators are used during one treatment? I'm assuming of cool sculpting.
Yeah, that's a great question. So the prior model was you paid per applicator, and sometimes that didn't turn into a very effective treatment because people were trying to save costs. Now, the amount of applicators we apply per treatment really depends on just how much you need. So if the area is, you pay your standard 2,400 for that first area, and we put on as many applicators that your body needs to make sure that area is effectively covered. Um, and what you do is you actually get a number of treatment sessions with that price. So the first one is your actual like big treatment, and then you can come back in about 2 months to do any sort of refining where we can then be like, oh, this area needs a little bit more, this part's done, let's do the whole thing over again. Anything like that to kind of boost your results. But it's very individualized. And this new pricing model really allows us to treat everything very completely.
Perfect. I had a few questions come through in regards to the pricing of smart liposuction, specifically either average cost or tailored to Lipo 360.
Yeah, the average cost for Smart Lipo is $1,600 an area. There are fees according to BMI if the area is like much greater than if you're out of like the average BMI, there's a few fees that way. And there is one standard OR fee of $1,000, but each area is $1,600. Of course, you'd get the discount from being on the webinar today. And so Lipo 360 with those four areas, you can do the math. It's 1,600 times four.
Another question, should you wait until you reach your goal weight prior to either of these procedures?
I love that question. People ask it all the time. I'll tell you that there's not like a right or wrong answer. If you feel like you're just at the beginning of your weight loss journey and you have a significant amount of weight to lose, then I would say you should wait till you get closer to your goal. But there's certainly like a subset of patients that I see where Smart Lipo is almost like motivating. So they come in, they invest in the Smart Lipo, we improve their contour, and then man, they lose additional weight. It's like very inspiring that to them to like see that shape come forward. And so it almost kickstarts their weight loss journey. So a little bit depends on you and your goals. If you're someone that no matter what your weight is, you've always had a double chin or you'll always carry weight in your lower stomach, then you can, target that at any point. But if you are someone whose weight is like wildly fluctuating or you really have a significant amount of weight to lose, then it's best for you to get closer to your goal before considering smart lipo to get rid of those stubborn areas.
Perfect. On the same vein, does loose skin shrink after the procedure?
No. Smart lipo does cause like a little bit of skin tightening, and I'm always impressed with how much the skin retracts back when I think that maybe it won't. I'm like always pleasantly surprised. But smart lipo is not a procedure for loose skin. So if you have a significant amount of loose skin, you are really needing to look at a surgical option to remove that loose skin. Now, like abdominoplasty or a tummy tuck, or an arm lift, smart lipo will not cause like a drastic skin tightening, but the laser does cause a little bit of dermal contraction to get a little nice tightening so that when the fat is removed, it's not left hanging.
Right. Is lipo or cool sculpting better for the arms?
It totally depends. I've done cool sculpting on my arms. I loved it. I feel like the arms respond really nicely to cool sculpting. But if you have a decent amount of fat, probably liposuction is better.
What is the BMI limit and what is the fee?
You might know that better than me. The limit is, well, okay. So in general, okay, Devin, you correct me if I'm wrong. The
Yeah.
practice, we say, we like your BMI should be under 30. Otherwise, the risk of complications is high, and really you need to work on diet and exercise. That being said, BMI is an imperfect measurement, and if your BMI is that high because you are solid muscle, that's different. Or if your BMI is very high, but the area you're wanting to target is a very focal thing like the chin area, you really that's also something that we don't make like a hard and fast, oh no, you're too big for this. That's not how it works. It really needs to be individualized based on your body and what you're targeting. Um, the fee is graduated, and anything under 25, there's no fees. Um, in 26, it adds $100, right? Up to 30 where it goes to 500.
Perfect. I have a couple questions about downtime. I'm just going to group them together. When you say a week's downtime, is this limited activity or no activity? Laying in bed for a couple days? And then also, what's the typical downtime from working out slash running after lipo?
Great questions. Okay, so cool sculpting, no downtime. Liposuction, there is not a point where you're like bed bound after smart lipo. You will be walking out of the office, and you should be walking to the bathroom, walking to dinner, that kind of thing. Now, that first night, people are like on their couch watching a movie. They're not like running around. But there's never a point where we're like, oh, you can't, walk. With regards to exercise, I actually tell my patients they need to wait a week, and then at a week, you kind of start slowly back up again. And that's just for safety's sake. Um, and like limited activity, it's not, there's no stitches, no one's removed skin, so there's not rules like, oh, you can't pick up something over 10 pounds. That's not the kind of restrictions that you receive with this. It is just basically you need to keep your compression on, and I want you to keep your legs moving. I don't want you to just kind of like sit around. But I don't want you running a marathon, which I have had a patient do. Ran a marathon the day after Smart Lipo, if you can believe that. Not with my permission, told me about it afterwards. Not recommended.
Wow. Does smart lipo have any effect on cellulite?
I used to say no. Very, like, that's the classic textbook answer because cellulite is actually having to do more with the fibrous bands that are pulling down on the skin. But when we do smart lipo of an area, I have only seen improvement in cellulite. The only time you might think like, oh, that looks worse after liposuction is if it's not true cellulite, if it's really just a lot of significant skin laxity, and then by removing fat, you're making the skin look worse. Those patients aren't usually a good candidate for smart lipo anyway. But I've always been pleasantly surprised, like, oh, the cellulite above the knee area, and this might be getting more into like the lipedema territory, how much that texture actually looks better after smart lipo.
But which procedure do you recommend for cellulite treatment?
It completely depends on you and your skin. Like that needs to be talked about in office because there's not one blanket thing that works for cellulite because cellulite's kind of a catch-all term. If you've got the discrete dimples in your buttocks, they get treated very well with subcision, which means actually breaking the band that pulls down. If you've got just a general textural change and you're looking for something non-invasive, then we do some blended biostimulators to help improve the skin quality. If you have a decent subcutaneous fat layer that's thicker, then thinning that out through smart lipo helps. So it's an individual thing. Creams do not work. Maybe like suction things work temporarily by causing some temporary swelling, but cellulite's hard to treat in general because it's not a pathology. There's nothing wrong with it. Like in women, those bands run up and down, whereas in men, they crisscross and it holds their fat in. So it's something that we as society have determined we don't like or it makes us uncomfortable, but it is a normal, natural skin type. So it's hard to fix.
Can smart liposuction cause worsening of skin laxity, specifically in the inner thigh area?
Yes. I mean, it depends. It depends on your age, your degree of skin laxity, and your overall goals, right? If you already have loose skin, then when you remove the fat, then the skin might get more loose. And some people that's not acceptable because their goal is like bikini. And then for other people, they're like, wanting to feel good in my yoga pants. I don't want my thighs to chafe and cause rashes and irritation, and a little bit of different goals. So it's a potential. You have to kind of be looked at to determine how big of a risk there is.
Do you order any pre-op testing?
Yes. All of our Smart Lipo patients have standard labs done that need to be done within a month of the procedure. We look at your blood counts to make sure that you're not anemic or have any issues that might make you have a difficult time fighting an infection or anything like that, problems healing. We look at your liver and kidneys to make sure you can handle the fluid and process the lidocaine, the numbing medicine. Um, and we checked some other standard labs for any kind of invasive procedure that involves needles. So,
Perfect. Do you charge a consultation fee? If so, how much?
no. And like I was saying before, we offer complimentary consults, and Devin you spend 30 minutes with the patients, right? Is that about how
I
long?
block out about an hour, so it's really just however long we need.
That's wonderful. So no, we offer complimentary consultations. Devin is given this luxury of time to kind of go over everything with you at the office. If she needs me or wants a second opinion, I pop in and see you as well. So that's actually, I think, one of the benefits of being here at Westlake Dermatology, that we have such well-trained consultants and then the doctors right there to jump in and kind of give the thumbs up, green light, quick thing.
Perfect. And then I just had a question about the discount and when it expires. I can answer this one, but everyone will be getting a follow-up email that kind of has all those fun details on it. But basically, the offer expires by 7/31. So as long as you have your procedure by the end of July, we'll be able to honor that $200 off. And it is for both procedures, the cool sculpting and the liposuction. And then, unless anyone has any last minute questions, I've reached my end.
Okay, that's great. Those were great questions, and we'd be happy to see you, evaluate your body, help you feel good about yourself. And again, if you'd like to see more before and afters, go check out our website. We've got some great photos up there, and they'll give you kind of a better idea. Maybe you can find someone with your body type.
Thank you. That was fabulous.
All right, have a good day, everybody.